Stroke is an underrecognized, underappreciated, underrated women's health issue, period. I'm Dr. Leah Kroll. I'm a triple board certified neurologist, stroke neurologist, and lifestyle medicine specialist. And I want to talk about this issue that's very near and dear to my heart because, frankly, we are not doing enough to raise awareness. The rates of stroke in women are rising. That's especially true for younger women and women of color. So every woman needs to hear this and needs to arm herself with the power that is this knowledge. Let me start by sharing some cold, hard facts. First of all, a woman's lifetime risk for stroke is higher than a man's. In fact, 1 in 5 American women will have a stroke in her lifetime. 1 in 5. That's not a small number at all. Every year, twice as many women die of stroke as they do of breast cancer. And we do a great job of staying on top of our breast cancer risk, of getting yearly screening mammograms. Well, I think we need to be doing the same for stroke risk, considering these numbers. Why do women even have a higher risk of stroke than men? Well, it comes down to basically 2 major factors. First of all, a woman's risk for stroke is more strongly affected by traditional vascular risk factors like stress or high blood pressure compared to a man's risk for stroke. Unfair, but true. And the second piece of this is that women have sex-specific risk factors that they may not be aware of. So some of those risk factors are things like a history of getting your period early before 10 years old, having early menopause before 45, having a history of conditions like endometriosis or migraine with aura, having a history of pregnancy complications like preeclampsia, gestational diabetes, preterm birth, gestational hypertension, and certain hormonal medications. All of these things can increase the risk of stroke for a woman later in her life. So what do we do with all of this information? We need to approach stroke risk the same way we approach breast cancer risk. We have no problem getting our yearly screening mammograms, going into the primary care office or the OBGYN office and talking to our doctor about what screening we need for breast cancer and what risk we may have. We need to do the same thing with stroke. So women need to educate themselves about what their unique and specific risk factors are. Do they have a particular family history of stroke or heart disease or blood clots? These things should be discussed with their doctors. That way, they can work with the doctor to modify that risk as much as possible, right? So depending on who you are as an individual, you and your doctor may work on things like quitting smoking, cutting down on drinking, controlling your blood pressure, your cholesterol, staying on top of diabetes, making sure that your diet is healthy and good for the brain and heart health, making sure that you're exercising, that you're managing your stress well, that you're sleeping well, whatever it is that you need to do as an individual to modify your unique risk for stroke.